Genital warts, a legendary condition that dominates the sketchy ads on every telephone pole. Because the warts in the infected area often look like cauliflower, it's also nicknamed the Cauliflower Disease. The culprit behind it is the now infamous HPV. 85% of sexually active people, at some point in their lives, will inevitably cross paths with it. Its nickname on the streets is the Human Papillomavirus. If you're lucky, an infection might lead to common warts, filiform warts, flat warts, or genital warts, and other skin lesions. Those little fleshy bumps you've seen on the skin, there's a good chance that's a wart. But if you're unlucky, it could lead to cervical cancer, vaginal cancer, anal cancer or pharyngeal cancer or penile cancer, basically malignant tumors. Oscar-winning actor Michael Douglas famously revealed that he developed throat cancer from an HPV infection. According to the World Health Organization, over 300 million people worldwide are infected with HPV. More than 99% of all cervical cancers are linked to HPV infection. And 90% of anal cancers are also closely tied to HPV. So this makes us wonder, why is HPV so inseparable from warts? And why does it have this lingering, complicated relationship with cancer? What's the connection between a wart and a tumor? And how can we prevent, treat, and identify them? In this episode, let's dive deep into the truth about HPV. I promise it's going to be an eye-opener. First, let's be clear, HPV isn't one single virus, but an entire family of them. As of now, we know of over 200 subtypes. Some types of HPV aren't deadly, but they are nasty. They mainly cause wart-like growths, such as genital warts, common warts, and flat warts. These are known as the low-risk types. On the other hand, high-risk HPV can cause malignant lesions like cervical cancer, penile cancer, and anal cancer. These include HPV types 16, 18, 31, 33, and so on. Of these, 70% of cervical cancers are linked to type 16 and 18. With such a huge family of viruses, it's no wonder that sexually active people can easily fall prey to HPV. However, you absolutely shouldn't equate an HPV infection with an STD. And we'll break down exactly why. As we all know, the skin being the body's largest organ protects us from invasion by many pathogens, but HPV is one that actually hijacks skin cells to replicate. So this long line of defense, our skin, is basically like a maternity ward to HPV. Of course, this doesn't mean HPV can take root the moment it touches the skin. It needs to wait for an opportunity, for a small break in your skin or mucous membranes, or for the skin to become wet and soft. Then it has a chance to reach its dream destination, the basal layer. So why the basal layer? Our skin is divided into the epidermis and the dermis. The basal layer, cells are located at the very bottom of the epidermis, and they can continuously divide and move outward, constantly replenishing the various cells in the epidermis. And what HPV is after is precisely this replication function of the basal cells. Once it reaches the basal layer, HPV can release specific viral genes to control them, turning the basal cells into emotionless reproductive machines. Large numbers of infected cells replicate uncontrollably, and as they move towards the skin's surface, they gradually accumulate, forming the warts we can see with the naked eye. Different subtypes of HPV infect different parts of the body, forming warts of all shapes and sizes. Common warts, also known as verrucas, tend to appear on the back of the hands and on the arms. They start out as pinhead-sized bumps and gradually grow to the size of a soybean, with a rough surface and a hard texture. When they show up on your feet, they're called plantar warts, and some people find them very painful. These are all caused by HPV types 1, 2, and 4. Filiform warts tend to pop up on the eyelids, neck, and chin. They look like single, soft, thread-like projections, with a keratinized tip like a tiny inverted nail. Sometimes the wart can be quite large, looking like a flower bud about to bloom. When it spreads out, it can even look like a lotus in full blossom. Flat warts are mainly caused by HPV types 3, 10, and others. They are commonly found on the face, the back of the hands, and the forearms. They appear as flat raised bumps the size of a sesame or mung bean, with a relatively smooth surface. Once these warts get scratched open, or when the infected skin cells die, a massive amount of the virus gets released. At this point, it can infect other parts of your body, or even other people. The good news is, as of now, all of these are considered benign. The bad news is some types of HPV prefer to infect mucosal epithelial cells, including in the mouth, genitals, anus, and cervix. And this is what we're more familiar with genital warts. The incubation period is usually around 3 months. They often appear as growths of various sizes, shaped like cauliflower nipples or a coxcomb. Sometimes they can cause itching and a burning sensation. Pain and bleeding might occur during sex, and they can easily break open or erode. The good news is that 90% of genital warts are linked to HPV type 6 and 11. which are the low-risk types. Most likely they won't progress beyond just being warts. The bad news is if you're infected with a high-risk type of HPV, like type 16 or 18, your epithelial cells are at risk of becoming cancerous. It could, within 10 to 20 years, break through the epithelial basement membrane and invade other tissues, transforming into cervical cancer, vaginal cancer, penile cancer, anal cancer, or oral cancer, and other malignant tumors. So is there any way to prevent this? Yes, the key to preventing HPV is to cut off its transmission routes. The most common route is the one we're all familiar with: sexual transmission during sex. If there are any sores on the mucous membranes, or if things get a bit too rough, causing skin damage, it can create an opening for HPV to sneak in. If either partner carries HPV, a single, unprotected encounter has an infection rate of 40 to 60%. So use a condom, and use a condom. Also try not to get too adventurous. Exploring new territories or going off the beaten path will increase the probability of infection. Also, don't frequently change sexual partners or visit sex workers, because more partners means much higher risk. Besides, many people with HPV are either in the incubation period or asymptomatic, so you can't tell if someone has it just by looking at them. Second, get vaccinated. I'm sure you've all heard of this. The HPV vaccine is the only vaccine in the world that can effectively prevent cervical cancer. At one point, it was nearly impossible to get a shot. Let's quickly cover 3 key points. First, the so-called 2-valent, 4-valent, and 9-valent vaccines refer to the number of HPV types they protect against. The higher the number, the more HPV subtypes it can prevent, but they all cover the high-risk types, 16 and 18, which are linked to cervical cancer. Second, guys can get it too. Just because the HPV vaccine can prevent cervical cancer, don't label it as something exclusive to women, because at its core, it's about preventing infection from specific types of HPV. When guys get the vaccine, it can to a certain extent help prevent HPV-related genital warts and related cancers like penile and anal cancer. It's also a way to protect your partner. That's why vaccination is also recommended for men. Having a long foreskin increases the risk of infection and recurrence. Third, get it early. Currently, the World Health Organization's recommended prime age for vaccination in females is 9 to 14 years old. It's best to get vaccinated before you become sexually active. But getting vaccinated anytime between 9 and 45 years old still offers protective benefits. Lastly, you need to be aware of the possibility of indirect HPV transmission. For example, if someone in your home has an HPV infection, avoid sharing personal items and wash your underwear separately. Another example, those small private clinics advertised on utility poles might have issues with contaminated gynecological equipment like colposcopes. So for any gynecological issues or andrological problems, it's best to go to a proper legitimate hospital. So what if you do get infected with HPV? What can you do about it? Right now, the perfect drug to cure HPV can be summed up in 2 words. It doesn't exist. So why are there still legends of HPV? Miracle drugs floating around the internet. The key is that after some people use them for a while, they actually do get better. The reason is very simple. The vast majority of people get better all on their own. 90% of HPV infections can be completely cleared by the immune system. Even those extremely annoying genital warts have to bow down to our immune system. It turns most HPV infections into transient infections. That means they either cause no symptoms or the symptoms appear briefly and then quickly disappear. 60% of those infected can clear the virus within 6 months. However, you should never ever think that you can just wait it out after getting infected, because there's still that 10% of people who will experience recurrent persistent infections. Some people will develop warts. If this happens, it's best to go to the hospital to have them removed as soon as possible. That's because warts are contagious. They'll just keep spreading, and the more you have, the harder they are to treat, depending on the number, size, and location of the warts. There are targeted removal methods. These include medication, laser electrocautery, and cryotherapy, or even surgery. For another group of people who are infected, there might not be any visible signs on the surface, but that doesn't mean everything is fine. Because if you're infected with a high-risk type of HPV and it persists for a long time or keeps coming back, it could potentially lead to cancer. Over 99% of cervical cancers are closely related to HPV infection. In the year 2022 alone, there were nearly 150,000 new cases of cervical cancer in my country, and sadly, nearly 60,000 deaths. So if you're a woman and you experience increased vaginal discharge with an unusual odor, bleeding during intercourse, or pain, it's recommended to see a doctor as soon as you can. It's also recommended that women between the ages of 21 and 29, if you've ever been sexually active, should get screened for cervical cancer every 3 years. This is mainly a pap smear or TCT. It's basically a test to check the cells shed from your cervix to see if there are any abnormalities. For women aged 30 to 65, you should get a pap smear every 3 years and an HPV test every 5 years, because the earlier it's discovered, the higher the chance of curing the cervical cancer. Finally, whether we're talking about treatment or prevention, our immune system has to be involved. So we gotta treat it right. Get enough sleep, exercise moderately, eat a healthy diet, and keep a positive mood. Sticking to these 4 things can help our immune system rest up and recharge. It's like the old saying goes, you may only need an army for a day, but it takes years to build one. That way, when a critical moment arrives, our immune system won't fail us. All right, that's all for this episode. If you found this interesting or even a little bit helpful,